It's been 40 years since a Dodgers pitcher allowed Dr. Frank Jobe to perform a radical procedure on his damaged left elbow. That's when Tommy John surgery was born. As we hear from the staff at Midwest Orthopaedics at Rush, the surgical procedure involves reconstruction of the ulnar collateral ligament, replacing it with a tendon from elsewhere in the body, usually from the forearm, hamstring, or the foot of a patient.
And it wasn't until Dr. Frank Jobe, who's a famous surgeon from California, who was a longtime team doctor of the Dodgers, saw that Tommy John had failing elbow, had injured it, could no longer throw, and Frank had the courage to do an operation on a Major League Baseball player in hopes of him getting back.
Tommy John pitched for 13 years after recovering, retiring at age 46 in 1989. So far this season, 18 big league pitchers have undergone the procedure synonymous with his name. Dr. Bush Joseph says the surgery doesn't make the pitcher's arm any stronger, but it gets the ligament back to where it was before the injury. And it's the strenuous rehab that makes the arm stronger.
You come back like you should have been in the first place, or how you were before your elbow started to fail. Statistically, the odds will tell you that if you're a high school player and you have Tommy John surgery, your chances of continuing to play and advancing your career are about 75%. If you're a college player, it's about 85%. If you're a professional level player, it's probably about 92%.
Tests performed on prep, college, and pro pitchers indicate the ligament becomes frayed through years of abuse, starting in youth baseball. The problem can be traced directly to throwing too hard at younger ages, pitching too much, and specializing in baseball year-round. Doctors have come up with a number of different strategies to try to curb the rising number of ulnar collateral ligament injuries.
Number one, it's time, duration, effort. You know, like I said, the frequency of pitching, how duration, how hard, what balls they're throwing. Number two, it's just their skeletal age and fitness level. And then number three, it's proper form and technique. Proper form and technique does help prevent injury. But even with proper form and technique, if my arm's not strong enough or I'm throwing too much, something bad can still happen. As a high school student, that means at least 1 out of 4 kids who has Tommy John surgery is never going to play baseball again. So there's two ways of thinking about it. It's clearly not the automatic that we think. And the hope is we get kids back to a stable elbow that as they grow and mature and get better muscle mass and better